Hello and welcome. Today, we're diving deep into a common but potentially serious respiratory illness, influenza with lower respiratory involvement. We'll explore what it is, how it affects you, and what can be done about it. Let's get started. Influenza, commonly known as the flu, is caused by influenza viruses. These viruses are primarily of types A, B, and less commonly C. Type A is further classified into subtypes based on two proteins on their surfaces, hemagglutinin H and neuraminidase N. The most infamous strains, like H1N1 and H3N2, are examples of this classification. While the flu can affect the upper respiratory tract, in some cases the infection spreads deeper into the lungs, leading to lower respiratory involvement. This is often the case with severe cases of the flu. When an influenza virus enters your respiratory system, it begins to infect the cells lining your airways. This initial infection often starts in the upper respiratory tract. However, in cases of lower respiratory involvement, the virus travels down into the lungs, infecting the cells of the bronchioles and alveoli. This viral invasion triggers an inflammatory response. Your immune system rushes to combat the virus, releasing cytokines and other inflammatory mediators. This inflammation damages the lung tissue, leading to fluid leakage into the alveoli, making it difficult for oxygen to transfer into the bloodstream. This process is the underlying cause of the cough, shortness of breath, and other respiratory symptoms associated with severe influenza. Influenza is a global issue, with seasonal epidemics occurring every year. The peak season for influenza in temperate climates is typically during the winter months. However, it can circulate year-round in tropical regions. The burden of influenza is significant, especially among vulnerable populations such as young children, the elderly, pregnant women, and individuals with underlying health conditions. Outbreaks can strain healthcare systems, leading to increased hospitalizations and, in severe cases, mortality. Certain influenza strains can also cause pandemics, like the 1918 Spanish flu and the 2009 H1N1 pandemic, underscoring the virus's ability to evolve and spread rapidly. The symptoms of influenza with lower respiratory involvement are often more severe than a typical flu. Common signs include a high fever, persistent cough that may produce phlegm, shortness of breath or difficulty breathing, chest pain or discomfort, fatigue, body aches, and headaches. In some cases, patients may experience wheezing or crackling sounds in their lungs. It's important to note that these symptoms can quickly worsen, requiring immediate medical attention. Diagnosing influenza with lower respiratory involvement typically involves a combination of clinical evaluation and laboratory testing. Doctors will assess your symptoms, listen to your lungs for abnormal sounds, and may order a chest X-ray to visualize the lungs and identify any signs of pneumonia or other complications. Laboratory tests, such as a rapid influenza diagnostic test (RIDT) or a polymerase chain reaction (PCR) test, can confirm the presence of influenza viruses in respiratory samples, like nasal swabs or throat swab. While there aren't distinct classifications of influenza with lower respiratory involvement beyond the general flu strains A, B, C, the severity can be graded. Mild cases might involve moderate lung inflammation with no severe breathing difficulty. Severe cases may present with acute respiratory distress syndrome (ARDS), requiring intensive care. It is important to recognize that even an infection with a common strain, such as H3N2, can become a dangerous lower respiratory infection. These are best understood as spectrums of illness, rather than distinct classes. Treatment for influenza with lower respiratory involvement focuses on managing symptoms and preventing complications. Antiviral medications, such as oseltamivir and zanamivir, can be effective in reducing the severity and duration of illness, especially when started early. Supportive care is crucial, including rest, hydration, and pain relief. In severe cases, hospitalization may be necessary to provide oxygen therapy, mechanical ventilation, or other advanced respiratory support. Antibiotics are not effective against influenza itself, but may be prescribed if a secondary bacterial infection develops, such as bacterial pneumonia. Prevention is key to minimizing the risk of influenza. The annual flu vaccine is the most effective way to protect yourself and others from the virus. In addition to vaccination, practicing good hygiene, such as frequent hand washing, covering coughs and sneezes, and avoiding close contact with sick individuals, can help prevent the spread of influenza. Public health measures, such as school closures and travel restrictions, may also be implemented during outbreaks to limit transmission. The prognosis for influenza with lower respiratory involvement varies depending on the severity of the illness, the patient's overall health, and the promptness of treatment. While many individuals recover fully, some may experience long-term lung damage or other complications. Recent research is focused on developing more effective antiviral therapies, improving diagnostic tools, and understanding the mechanisms of influenza pathogenesis. Scientists are also working on universal flu vaccines that can provide broader and longer-lasting protection against multiple influenza strains. These advances offer hope for better prevention and treatment of influenza in the future.